and welcome to Money and Impact. My name's Suzanne Caldeira. I'm a mortgage lender. I've been in mortgage lending for the past 24 years and have named the show Money and Impact. Deal with a lot of money, from buyers trying to figure out how much money they need for their first house to folks that are trying to figure out strategies for their next piece of real estate or their refinance. And impact. Throughout the course of my life and career, I've been really lucky to have met some people that have impacted me both personally and professionally. And today I have someone with me that touches on both, and that's Dr. Berin of Berin Psych. Thank you for being here.
Thank you so much for having me.
I am excited to dive right into your story. What got you into this in the first place?
It's a really lovely question. It's a loaded question, but to answer your question, my dad passed away when I was 18, and I think that set the trajectory for really falling in love with the field of psychology. I did not necessarily know what branch I was going to go into in college, but I was fortunate enough to do 8 internships, and I realized what I did not want to do. So that landed me in graduate school for my doctorate in clinical psychology. And since then, I have had some really incredible opportunities to make impact and work across nonprofit and private practice settings.
What were the 8 that you didn't enjoy?
Probably not appropriate for TV. But in full transparency, there's the behavioral component of psychology, and then there's the clinical, and then there's the research. So the behavioral application piece is not something that is in my skill set, and the research piece, I enjoy reading it, I do not enjoy doing it.
Got it. Well, you are clearly making an impact, especially you talk about being involved in the nonprofit sector, and explain that and explain how that works in your practice.
So that's a great question. So I spent about 15 years a nonprofit. I was the director of a community mental health diversion program for children who were in acute care. So kids in crisis who did not meet level of care for inpatient would get diverted to this CBAT, it's community-based acute treatment. So I did that for a couple of years right out of graduate school after I got my doctorate. And it was an eye-opening experience. And then I transitioned to a different nonprofit and did a lot of work with kiddos and DCF care. So I oversaw DCF group homes, a number of them. And I did that until I left the nonprofit and started my own.
What drew you to go out on your own?
That's a great question again. For me, I wanted the flexibility of scheduling, and I wanted to be present for my children. And I also wanted the agency and autonomy to be able to do things my way.
And I think that's one of the skill sets that an entrepreneur needs, and also a woman in business. Yeah. And what are some of the challenges that you encountered when you were first starting off your practice?
So I started my practice back in 2015. I worked for a colleague of mine for quite some time, and I was just sort of getting my feet wet. And then in about 3 months before my daughter was born, I decided that was going to be a great opportunity and a great time to open up my own private practice. It was wonderful. I was very blessed, but don't do it while you're 6 months pregnant. That is not wise. And that really flourished very quickly. And I grew to love the business aspect of the work as much as I liked the clinical. And for me, I like the multidisciplinary piece. I like the leadership. I like the community. I like supervision. I like the development piece. I also like having relationships with my clients in ways that are really clinically sound and insightful and, in some ways, directive. So it was a really lovely combination of the two. And so when my son was born, I was on maternity leave for about 6 months, and I came back, and the values were very different. It was not aligned with what I needed for my family, and my school loans needed to be paid off. And
yeah, makes sense.
I was very fortunate that I had reached the 10-year mark, the month that I made the decision to leave the nonprofit world.
Smart, and it worked, I'm sure.
It sure did.
Now, mental health, a lot of us, me personally, and a lot of the viewers that are out there that are seeing this have struggles. What are some of the things that someone can do on their own, Anna, before, say, they reach out to someone like you?
So I think first and foremost is to recognize that A, you're not alone. B, that majority of us have some form of mental health challenge. It's just whether or not we're willing to acknowledge it. And then also just have a trusting person to be able to bounce ideas from. Those are the three. The next steps are really based on where the person is in their own process around wanting to make a change. I think there's a lot of people who may want to make a change, but there's a behavioral piece that requires you to actually take the next steps. So, and it's okay if you're not ready. I think the biggest hurdle is admitting it to yourself that you need the help.
Do you find that that's hard for people to do?
But by the time they come to me, probably not,
True.
But getting to a place of sitting in front of a practitioner, mental health practitioner, I think can be really challenging. And depending on what type of challenges they're working through, sometimes it is really hard to look in the mirror. I think shame and guilt is pretty profound, and and the fear of judgment is huge. So I think that those are some of the deterrents, aside from culture and what media portrays of mental health and mental illness.
You bring up culturally. How has social media affected your clients?
I think COVID, over the last 4 to 5 years, has really impacted access to information, but also misinformation. I think that there's a lot of misuse of psychological terms as well as diagnoses, and there is a sense of popularity around narcissistic type of abuse or bipolar behavior. And while there's a lot of people who may fit that diagnostic criteria, I think misusing the term takes away from the ones that are actually struggling with that level of mental illness.
Yeah, and with social media and with the pressures that people face, whether it be the woman that thinks she's too skinny or too fat or not enough, or for the child, what tips would you give someone that's just watching this to do to combat that?
So one of the things that I would recommend is to remain grounded in what you're seeing. Oftentimes what we see is not actually what is happening. You can edit, you can amend, there's so many different filters that you can put on, that there's this perspective that whoever's on, the videos or the memes, they're perfect. I haven't met one single perfect human in this world yet.
Damn.
And I've traveled quite a bit, and I've met some interesting characters, and I've met some really incredible people, and not a single person is flawless. We all have something, right? And I think that if we're looking enough for something that we don't have in somebody else, we'll find it. But it doesn't mean that we may not have it. It just means that we might not be able to see it.
And for your practice, are there certain traumas or certain types of things that your practice focuses on, or do you help anyone?
So, from a integrationist and generalist perspective, we will work with anyone who wants the support. One of the ways that I assess who may be appropriate for our practice and who may be requiring a higher level of care is based on the acuity of their symptoms. So if somebody's presenting in acute distress to the point where they're a danger to themselves or to others, or their behavior presents as very disorganized, then my recommendation would be that they go to their emergency department. And I say that with caution because that is also may not always be helpful, right? So I recognize and I understand that as much as we want to expand access for mental health, although we may not be able to offer what they need, the alternatives may also not be the best, right? There's so much, concern, and there's a lot of stigma about going to the emergency room and then getting referred into an inpatient unit. And then there's a lot of controversy around the operations of an inpatient unit and whether or not, they keep clients for the fiscal component versus, ethically as to whether or not they meet criteria for medical necessity. So there's a lot of different pieces, and I recognize that. So I don't say that lightly, but we will screen clients based on a variety of different levels.
Where do you get the most joy in your practice?
I think it's twofold. I think part of that is seeing my staff grow and giving them the mentorship that I wish I had in developing my career. And then the other piece is giving our clients what they need, because my rule of thumb is, would my family want this? Or would I want this for my family? If the answer is yes, then we're doing very well by our clients. And if the answer is no, then we need to pivot and we need to adjust. So I think I get joy from both parts, because this is the reason why I expanded my practice rather than staying as a sole proprietor. I need more to be able to do. I think therapy is important and it's valuable, and I'd like to believe that I'm really good at my craft, and I want to give back more, and this is one of the ways that I can.
Have you found any clients that have dealt with any stigmas with therapy that maybe their friends or family in their inner circle have?
All the time.
Yeah?
All the time. I feel like we're constantly righting the wrong, and I'm constantly apologizing for, this may not be a very popular opinion, but for what other practitioners have or have not done. Especially, I see that a lot with marginalized communities, those who have visible and hidden identities that are marginalized, especially in the LGBTQIA+ communities. People of color, women of color. I know that I am not a person of color, however, I am an immigrant. I have, I've been naturalized in America, but that is, my identity is of a Russian Jew, and that in and of itself carries a host of stigma. So, and my family is multiracial, and I myself have had an interesting trajectory across my personal experience. So while I look, white, and I am white, there's a lot more to me than that. And when my clients come to me, there is a level of humanity and transparency and honesty that I have with them, and I think that is what they most appreciate. I am not your cookie cutter practitioner. I don't work off of workbooks. Some may, that's just not how I function.
A lot of us have biases. We are human. And could that be that maybe those former practitioners allowed their biases to affect how they treated the marginalized clients that have come to you?
I think it would be fair to say that before we sit with clients, we have to do our own work. And it would be also fair to say that there's a lot of people that I have met in my industry who need to continue doing their own work. So while I don't know what may have interfered in that therapeutic relationship, what I do know is that there's enough evidence to suggest that not everybody does their work before they're able to sit with clients.
How do you get to a point where you don't judge as just a normal person? I mean, you're a practitioner, you're a doctor.
Yeah. So I think that you have to be honest with what your values are, and you have to make sure that the services you provide are aligned with what you want to be able to offer. And if there's anything that is not aligned, that's where the work is. So again, I'm very particular and very clear about where my values are and where our boundaries are in terms of the type of clients that we work with. And I will be very honest with people about, hey, this is not my area of expertise. In fact, I'm happy to refer you out, but I won't be able to, or my practice won't be able to support you here. I think a lot of people are afraid to say no, and there's a lot of people who are afraid to offend. I think the greater harm comes when you're not honest with where your limitations are. So my recommendation to practitioners who are starting or who are working through some of their own personal challenges is sit with them. You cannot help somebody who is struggling unless you have done your own work. And are people going to argue with me? Sure, but I'm not really interested in an argument. You cannot do effective work unless you've done your own work. And you're going to do much more harm.
And sometimes people have a hard time with the truth.
They do, so don't come to me.
So you're a mom. You're a mom of two.
I am.
And you're running a business, and you're running a practice, and you're juggling it all.
I am.
What do you say to a working mom that might be overwhelmed?
Have some grace. Give yourself some grace. It is a balancing act. And I think that finding a community that will honor what your needs are while also being able to give you the flexibility and agency and autonomy to do what you love is really why I created Berin Psych. And my goal was to hire moms, and now it's expanded to dads and to parents in general. And I offer them, flexibility in their schedule as long as I know when they're working. I don't care if they're working at 8 in the morning or at 10 at night. If it suits our clients and that's where the need is, be as flexible as you need to be. As long as they're meeting, the parameters of productivity, it makes no difference to me when people are doing the work. As long as they're doing good work, ethical work, appropriate work.
And do you feel that the support of your husband helps? Like having that supportive home base?
Oh, unequivocally. He always says to me, and I can't do this without you, and in full honesty and transparency, I wouldn't be able to do what I do without him. He is an incredible, friend, partner, father. I could not be more blessed.
What drives you?
My passion, my love for staying honest and true with where my fulfillment and meaning is. I spent a long time in my 20s trying to figure out how to live a life that feels very egocentric, which is consistent with who I am as a person versus what other people want of me. And I made a commitment to myself that I was going to live in the way that I needed to in order to be able to wake up every morning and be okay with who I was. And that required quite a bit of adjustments, and it also required a lot of boundaries around what I would and would not tolerate. And sometimes that also resulted in lost relationships or resulted in conflict. So what drives me is, I think what drove me prior to my kids is a little bit different than what drives me now. But I think the common denominator is that I love what I do and I'm very blessed to do what I do. And I always reflect on something that my mother told me, probably after I got my master's. She said, if you were in Belarus, you would be doing what you needed to do. But here in the United States, you're doing what you love to do. And that is a privilege in and of itself. And I've never forgotten that because I think that she's absolutely right. I have the privilege and the ability to be able to say, this is what I want to do and do just that. And I am not limited by the things that I was when I was younger or what I would have been if this was a different state of affairs.
For someone that may be dealing with their own personal limiting beliefs, maybe they haven't come from much, or they have, or they don't have needs or certain needs or necessities. How would you suggest that person works on their own beliefs?
I think that if you believe that you're not going to be able to do something, then there is something that's called a self-fulfilling prophecy and you won't be able to do it. I think giving yourself an opportunity to look at the data and to assess whether or not those limiting beliefs are based on past experience versus your anticipatory worry about failing. I think that, somebody who's in survival mode can't step out of their survival mode brain, right? So they're constantly going to be in a worry state. But if you're able to ground yourself, look at it from a rational perspective and say, is my fear limiting me, or is it really my experiences that have led me to believe that I am not worthy? And I think that you can do really good work with a practitioner of any type, really. It's just you have to make sure that they are able to support you in helping you to discern how much of those beliefs are core beliefs versus how much of those beliefs have been reinforced by experience or by just fear. I mean, fear drives many of us. I am really risk averse, but people who know me would say that I am quite a risk taker. So it's quite the dichotomy, but I think I take calculated risks. And the risks for me are really intentional around impact. And I had somebody years ago ask me if whatever happened to me that evening was repairable. Is it fixable? And I said, no, it's not fixable. And they said, okay, well, maybe it wasn't meant for you. And I only saw that person that one time, but it was something that gave me perspective, that even though in the moment it may feel this catastrophic, I was blessed enough to know that it is just one experience that I don't have to redo, and that's okay.
Have you always been this rational?
God, no. It's interesting. I don't really consider myself to be a rational person. I consider myself to have rationality.
Well, you know why I said that? Because you had said about looking at the data and making decisions.
No, I function intuitively. I
Okay.
function very intuitively. I have good instincts. Sometimes I do not like to listen to my instincts because they're inconvenient. They're very inconvenient, but they're almost always right. And so I try to give people the benefit of the doubt, and I try for them to show me something different. But what I've learned is that people show you who they are. You have to believe them.
And your instincts, that's your gut, right?
That is my gut. It is my gut.
You know, anytime I've gone against my gut, I've been wrong.
Yeah. People show us who they are. We have to believe them. And if we don't believe them, then generally it's something about our own selves that is interfering. What is it that I need from this that is blocking my ability to make a decision that would be in the best interest of my family, or in the best interest of my health, or in the best interest of my wallet? It really has a lot to do with what we're projecting onto the situation.
Now, you mentioned your father, your mother. Who have been some other mentors in your life that have shaped you?
I think my brother. He is 8 years younger than I am, but he has been incredibly invaluable in helping me see perspective, helping me to stay present and grounded, helping me take an honest look at myself. And although some of our conversations can be quite passionate, and my husband can attest to that, and so can my mother, he is the one person in my life who has always, irrespective of how crazy my decision was or whatever choices I have made, has always supported me. So my husband loves me unconditionally, and I would say that my brother loves me unconditionally. So outside of family, I would say that my professional experiences have certainly shaped me. I've had multiple mentors who have outlined for me the type of practitioner I want to be, the type of leader I want to be, and also the type of therapist that I am not, and that I will not strive to be, because that's just not consistent with who I am. And then there's all of the other experiences that have shaped me that I could consider a part of mentorship, but that was like baptism through fire. And that's a reframe. It's not a mentoring experience. When you have to walk through life in a way that you wish you would have had some guided support rather than having to figure it out on your own. It makes it quite challenging. But
have you had any patients that maybe when you first saw them, you were nervous that maybe you couldn't help them, but you were able to help them?
Oh, absolutely. Absolutely. And I think that comes up often for me, right? Because I don't particularly see myself as my clients might often see me, right? So when they come to me and they have a variety of challenges, or they have a life that on the outside looks incredible, but yet they're suffering, right? My perspective is, well, what do I know about that? Well, I know a lot about suffering. It may look different, but the human experience of pain is often the same. And so I think once I get out of my own way and I allow my authenticity to come out, and my training, I think that it generally balances everything out. But yeah, I think imposter syndrome comes up often. It comes up often, not only for myself, but also for my colleagues. And I've made some really lovely friendships with private practice owners, and one in particular who I will bounce off ideas, and she's a really lovely sounding board. She's very rational. She's very methodical. She is pretty risk averse, and I'd like to believe that I'm complete opposite. And she's a really good person for me to be able to say, hey, I need a reality check. Is it me, or is something, where am I missing something?
I brought up social media earlier of how that can affect people. What about world events and those affecting people?
That's a heavy topic.
Yeah.
And I think that as a woman, as a mom, as a partner to a African American male, as someone who has had lived experience in the LGBTQIA+ community, as somebody who's an immigrant, as someone who has struggled in the world of academia with a host of hidden learning disabilities, it is quite scary, I have to say. And on Thursdays every other week at my practice, all of our practitioners get together and we have group supervision. And yesterday's group supervision was getting the pulse of how is everybody coping. And because Berin Psych employs practitioners who have lived experiences in the areas of clients that we serve, it is very raw and it's very real in our lives as it is in our clients' lives. And there needs to be a balance between figuring out what supports we need as providers and also knowing when we need to tap out and when we cannot be able to give because we need to receive ourselves. And so that's what we talked about yesterday.
Wow, Anna, that was powerful. And for anyone who has any questions on today's guests, keep an eye out for the credits. And this is Money and Impact, and I'm Suzanne Caldeira. Thank you.